Hello, everyone. My name is Danielle McGill. I'm disability consultant for Empowered Possibilities. I am here today interviewing Dr. Beth Boone. She's the executive director of CARD, which is the Center for Autism-Related Disabilities at the University of South Florida. It's an honor to have you today. And thank you for taking the time to speak with everyone today about what you do and what CARD does and your journey on this ADA venture for people with disabilities. And from what I've heard is that you're a powerful advocate within the community in Tampa. So thank you.
I appreciate being included. Thank you so much.
So I would like to ask you, what is your journey into this disability realm that we're in? How did you get into the work of disability services and helping others?
Sure. Thanks for asking that question. It's a bit of a roundabout journey, but I was interested from an early age in how children interacted with the court system. And in having some experience as a court-appointed special advocate, I worked with a young man with cancer and became, I think, more moved by some of his experiences in the medical system than his experiences in the court system. And so I actually went into graduate school in clinical psychology in a program that specialized in helping kids with medical needs. And so I worked in a hospital for a number of years and doing training. And I had a number of experiences that really struck me. And one of those was a beautiful young woman with very severe epilepsy that was being treated with the ketogenic diet in order to try to keep from having to do surgery on her brain. Mm-hmm. And she did a great job with the ketogenic diet. Back then it involved eating like pats of butter to keep that fat ratio high. And she would pop those pats of butter in her mouth and have no trouble. What happened was that she didn't really care to drink much. She didn't take in a lot of fluids. And so she and her family would go home and she would get dehydrated and they'd have to come back to the hospital. And so when I got called in as a psychology graduate student on that rotation, they said, we need to get this young woman to drink. And so feeling sort of full of my young power and training, I thought, I'm developing some really good rapport skills, some good therapy skills. I'll go in and help this young woman get past this barrier. And when I arrived in the room, I was quickly put in my place by learning that not only did this young woman have epilepsy, but she also had autism and didn't use words to communicate. And so here I am with all my newfound knowledge in therapy skills in talk therapy and cognitive behavioral therapy, and realized that those skills were woefully inadequate in helping in this situation. And it was at that point that I had to go on pure instinct, and this was long before applied behavior analysis was really a thing, and sort of tried to figure out what would motivate her, what were things that were truly interesting to her in order to encourage her to drink as part of her daily routine, and do that without a lot of words because she didn't have words to give me, and too many words on my part didn't result in any benefit. And we actually did manage to figure out some ways to get this young woman to incorporate drinking into her daily routine. And that, of course, is another story. But it really moved me into understanding that even though I was at a great prestigious clinical psychology program, receiving great cognitive behavioral therapy training, I did not know enough to help. And so when I got my PhD, I entered a one-year program in neurodevelopmental disabilities to really sort of beef up those skills with the full understanding that I would go back into the hospital setting afterwards and use those newfound skills when we had kids where neurodevelopmental disabilities overlapped with medical disabilities. And I did. I got into that year, did that postdoctoral year and all that training, and it really changed the course of my life. I realized that intersection between
That was your
disability,
defining moment.
it really was. I had a number of experiences that made me recognize that there was a real need for people to advocate for folks with disabilities to help break down some of the barriers in our systems, and really to learn from families and individuals in a way that you're not trained in graduate school.
Yeah, the best experience is through hands-on and actually learning from the people that go through it every day, day to day. And there's just some things that you just can't get in school, in a school setting or in a classroom setting.
It's
So
true.
that's
So I
amazing.
had those experiences and kind of never went back, and sort of went into clinical work with people with disabilities, and did some teaching, and sort of moved into where I am now, which is primarily administration, but advocacy and sort of barrier removal is part of what I do every day.
So, so can you describe what CARD does within the community for people with intellectual disabilities?
Yes, absolutely. CARD is a Department of Education funded program. We are funded on a line item through the governor's budget, so it's federal money from the Department of Ed. And we're in our 27th year, although I've only been at CARD for about 9 months as the executive director. But what CARD does is work with people with autism and related disabilities, their families, their communities, their caregivers. We provide some direct support, although not therapy or assessment, direct support for families and helping them build skills and learn coping and access resources. We do training for professionals and communities and families and businesses, and technical assistance for them as well. And then we provide a broad array of resources, information for families. And we also work really deeply within safety issues, within mental health issues, and within making the community more autism friendly. Now, you've got TLA listed there, also the director of TLA, which is affiliated with CARD, also at USF. And the Learning Academy Services is a program that provides a 1-year transition experience for young adults who have finished high school and want to either go to college or into the workforce, as well as
It's
providing.
wonderful.
Yeah, thanks. It's a really great to see what happens to the young people across the year. And we also provide the full array of employment services through vocational
And how has CARD become inclusive in the
I think that,
community and throughout?
yeah, I think that CARD is really funded and really functions with the idea of full inclusion in the community. And, you know, it's really important to us. We want everyone to have a community where they feel that they belong and where they are valued. And so through all of the services and supports that we provide, we're always seeking to remove barriers for individuals and families and help them towards wellness and greater quality of life. So it is, the idea of full inclusion is the cornerstone, really, of all the work we do. And it's one of the questions that we're always asking: what is standing in the way of this person having the life that they would like to have?
Everyone has purpose, everyone has value, and you summed up what the ADA is all about.
Mm-hmm.
It's about equality, inclusiveness, knocking down those barriers, and it looks like CARD has the tools that can help families tear down those obstacles and challenges that an individual may face. I would like to get your perspective on employment for people with disabilities, especially the intellectual disability part of it.
Sure, sure, absolutely. Well, I think that employment, although other than just being one of the titles of the ADA, is a really important factor in most adults in terms of defining their ability to provide back, you know, to provide to someone else and to provide for oneself. And in the disability community, it's tricky, you know, because if people have disability or SSI, you have to think about, am I making too much? And it's made very difficult by some of our systems, because if you become too independent with the services that you have,
Yeah,
and the
then they
service
say you're not disabled enough.
so you know, we really work on helping people to access learning experiences and employment experiences that are important to them, and to help them balance a little bit what they have to in order to keep their you know, sort of to keep their benefits. But we really believe in the quality of life factors that come from being employed. And that's true for people with intellectual disabilities, as well as the rest of us, that employment provides us stimulation and companionship or company, right? It provides us an opportunity to use our skills to benefit others, and then it offers us an opportunity to provide for ourselves. And I think that the quality of life aspects that all of those things feed into make it really important, even when it's complicated, right, to help people to access those experiences. And one of the things that we really do through both TLA and some of our autism friendly business initiative, which I'll talk about during the conference next week, is helping businesses to understand the benefit of hiring people that are neurodiverse, right? Some of the strengths that people may bring, such as great memory skills, the ability to work within a schedule and stay on task, and
Yes.
maybe not be as distracted by social opportunities and things like that, and really strong skill sets. And so we work really hard to help people find places where their particular interests and fascinations and areas of expertise can be used and valued.
What is the biggest barrier that you see among the population that you serve?
Great question. Thanks for asking that. I think there's a couple, one of which is low expectations, of saying, of assuming, low expectations and assuming, let's put that together, that assuming that because a person has autism or a cognitive disability or a physical disability, I mean, or a medical disability, I mean, let's just put them all together.
It's truth.
Right. That the focus then is on the disability, and that I think sometimes because we don't expect enough, we don't open opportunities enough for people to show us the ability, right? The abilities that they have and the opportunity to thrive. I think also our service systems are really fragmented. We have the medical service system, and we have the mental health service system, we have the DD service system, we have the education services, we have VR, and all of those things.
And they don't work together most of the time.
I think it's complicated. I think it's very hard when you have funding streams that don't overlap, that people kind of want to stay in their lane and fulfill their mission and the things they're required to do. But I think what ends up happening is that sometimes we duplicate services, like everybody's reinventing the wheel. We're doing this over here and somebody else is doing the same thing over there, when working together could make it stronger and help us reach more people. I think it also means that we end up with gaps in our service systems because we're all providing what we think we need. And if we don't talk to one another and our constituents, we miss what's not being what's not being taken care of.
So in your opinion, what is the biggest gap?
Oh, phew. you know, on a different day, that would be a different answer. But I would say right now, one of the things that, that from my background and from just the current, what's going on in the world, I think it's the interlap between disability and mental health. I think it's very difficult to have people access neurodiversity competent mental health services and get those paid for. I think sometimes people say, well, he does that because he has autism, rather than, you know, she's got depression or anxiety, in which the research is clear. You can have autism and any of the mental health conditions.
Yeah.
And then I think the ability to know what some of the special parameters are of therapy when you're working with somebody who may not have lots of language, who may have sensory issues on top of things, and how can you sort of bring those things together to be effective in therapy. So.
And what a lot of people don't know is that the disabled population has the highest alcoholism rate, the highest divorce rate, the highest unemployment rate, the highest suicidal rate, basically everything the highest.
And I think it does speak to a really strong need for us to cross systems and really try to figure some of these issues out. Absolutely.
So what would be your message for other organizations to promote inclusiveness within our communities, and what would be your message for elected officials?
Oh, both very good questions. Yes, and different questions. I think I've spent a lot of my career doing collaboration, trying to pull threads together so that systems can speak to one another. And I think that the most important thing is to establish a common goal. You know, what are we looking for? Are we looking for a strong workforce? Are we looking for a healthy population? Are we looking to decrease costs on this end or that end? And, you know, my encouragement to those various systems are talk to one another, take those meetings. You know, if you're working with an individual, find out who else they're working with. Find out, you know, it's hard for a single person, like a single therapist, to try to bring all these systems together. And I think that's where it gets bumped up a couple of rungs, where if directors can talk to directors and then we can try to pull the systems together, sometimes that's more effective. But even one person can make those inroads. If you're a therapist working with somebody and they're working with a speech pathologist or a special educator or VR, you know, pick up the phone, right? And let's make sure that we have all the information we need to be as helpful as we can. And don't, you know, start with yes, right? I mean, when they tell us when we do brainstorming that you write all your ideas down and you don't evaluate them right away, that every option begins with a yes.
And pick the 3 best ones.
Absolutely, but you
Go
don't
from there.
Yeah, right, but you write them all down first, right? And so you begin with the idea that everything is possible, and then you pick the best possibilities or the most important ones, right? For legislators, wow, you know, that's tough. Again, that's a question that changes, you know, depending on the month and even the day. Yeah, I mean, in the last month, I would have been Mr. Governor, please don't veto card, right? Because that's, you know, that's where we were, and thankfully they didn't. But oftentimes we want to get in front of our legislators and say, this is a group that needs to be seen, that needs to be heard, that needs to be valued. Like, and don't forget that we're out here.
And right? Not forgotten. That's the whole point of this 30th anniversary, is to make sure our voices are heard, right? And to have community partners like HARD and many others in the Tampa area, as well as throughout the state, becoming more unified. Because I think we could get more done if we're more unified and find the commonalities and similar goals of every agency, put them together and just go for it.
I mean,
versus,
to say we're
like you
here.
said,
Yeah.
fragmented all the time.
Yeah. I mean, to get together and to say, we, the community, we're here. We're not going away. We shop, we work, we vote, we have families, all of these things that are important to this system or this legislator, like those things are represented in the disability community, and to continue to make that noise so that we're not ever off the radar.
So what is your main message for the Americans with Disabilities Act for people to know? What is
Yeah.
the one thing you want them to know?
Wow. Yeah. None of these things are easy. I mean, I think what I'd say about the ADA is it really opened an important dialogue about how our society presents barriers to education, to employment, and to community in various ways for individuals with disabilities. It's a springboard, though, because the crucial conversation goes on. We have to talk about how planful accommodations provide access to a more full range of human experience for individuals with disabilities. And here's the important point that I would emphasize: how full inclusion enriches us all. It's not just about let's help this poor group of one sort or another get a few things. No, this is about having a full, rich society where we all benefit from one another. So
Especially our strengths.
Absolutely.
We're stronger together if we unite together and see the possibilities in everything, not just looking at a person for the outside of a person, even the behaviors of a person, because that does not define the whole person's life or perspective of things. We need to look outside of the box and not be so conformed to what our systems tell us all the time. Even though they're built to help us, in some ways, they're making us more disabled in other ways. So it's about finding a balance between the two. And it's been refreshing hearing it from or organizations' perspective and from a director like yourself. And it's refreshing to hear from your point of view. So thank you for meeting with us today and for your time and your expertise and sharing your personal experience. I really appreciate it. And
well, I am humbled and grateful. Yeah.
I look forward to seeing you on July 31st and helping our community celebrate the ADA and to learn what the titles really mean for everyone, not just the physically disabled, but everyone. So thank you so much.
I'm humbled and appreciative of being included. Thank you so much.